Hello, my name is Joel Gonzalez and I am the product specialist for Megagen USA. In the following video, we will be reviewing the technique of impressioning both the Rescue and the Easy Plus for final restorations. Now the Rescue and the Easy Plus implants are actually very similar in design, as they both have a tri-lobe connection or a tripod. In other words, it has three lobes on the bottom of the implant that are 120 degrees apart. So it's a tri-lobe connection, again, or tripod, with an 11-degree Morse taper. Now, one of the things to note that's very unique about the Rescue implant is that if we look at historically the implants of old, implants were designed mainly in the 3.75 and 4 millimeter diameter size. So as you can see, clearly, the molar implants with this picture that you're looking at now, you can see the same size implant utilized in all the same teeth. In other words, look at the size of the molar versus look at the size of the bicuspids. A typical bicuspid size tooth is about a 4 by whatever. But a molar is definitely not a 4 by 13. So therefore the implants used to fracture, as you can see in the upper right hand side. Thus, the necessity of a rescue type implant was born. Now, the normal process and procedure would be to get a trephine and core out that fractured implant. And again, you can see what would be left would be a big osteotomy or a big hole left, and thus the name rescue came to be, because the rescue came to the rescue with this larger diameter implant, placing them into these larger type osteotomies. And then we started utilizing this implant in much more wider fashion with your molar restorations. Why? Because a rescue implant is ideal for a molar restoration, because you have the natural forces of mastication as well as emergence profile and everything on these bigger, wider implants. Now both implants are bone level implants. So what does that mean? That means roughened surface to the top of the implant, but it has no polished collar whatsoever, which there's a lot of implant systems still on the market that still have a polished collar, so it decreases roughened surface area. You have a deep internal tri-lobe connection to avoid abutment micromovement. You also have platform switching built into these implants as well. But again, we talked about that deep internal Morse taper for a conical seal. Now, again, in this process, what we're going to be doing is reviewing the restorative impressioning technique for both implants. Even though both implants are different, obviously the Rescue implant is a molar implant and the Easy Plus is your traditional sized implant, 3.3 to 5.0. The process is exactly the same because they're both designed in the same way, just different diameters. Now if you note here in the flow chart, you can see the Rescue has your healing abutments, your impression copings, your lab analogs, and again, because there's one platform or connection for the Rescue, that means there's only one analog. So it doesn't matter what diameter implant you have with the Rescue, you only have one impression post and one analog, as well as one type of abutment, meaning one connection. However, you have various different options regarding sizes. Now you can clearly see the 6, 7, and 8 millimeter flare or profile diameter of the abutment with a tri-lobe connection on the bottom, and there is your transfer impression coping, your closed tray impression coping. If you need to have some sort of custom abutment, you can use UCLA. But note the huge 2.5 millimeter screw for the Rescue. Now here are the impression copings for the Easy Plus. Now you can see clearly the diameter difference. The Easy Plus is a smaller type connection, but again designed the same in the same fashion. Here is your closed tray, or transfer impression coping, and you can see the separate screw or guide pin screw that used to be with this type of implant. Now the Easy Plus has a different design of impression coping now, which you can see it here. It is a guide pin that has no hex hole in the very top of the guide pin itself. So therefore there is no hex there or no little hole for impression material to get down inside. So it's nice also because there's the deep grooves that you can see on the side of the impression coping that align with the lobes of the implant. Now the Rescue abutments came in 1, 2, 3, and 4 cuff height as far as your tissue goes. The Easy Plus abutments, as you can see, they're called Easy Post for the Easy Plus system. They come in 1, 2, 3, 4, and 5 millimeter cuff heights. as well as your 5 and 6 millimeter flare or profile diameter. Again, to note, your UCLA is your custom castable abutment option. So whenever you need some sort of off angulation or custom castable type abutment, you will use a UCLA for that, as the base is made out of gold, which is ideal for casting and so forth for your different type restorations. Now this is really important slide. Look at the picture on the left versus the right. The right impression coping, by the way, this is an open tray impression coping, is only seated down to the second thread of the implant, whereas the easy post open tray impression coping is down to the fourth thread on the left. So for the Easy Plus, the impression coping should seat clearly and firmly down to the fourth thread after you take your x-ray. One thing to note as far as screwdrivers go, everybody seems to get confused regarding screwdrivers. There's only 2 types of drivers in the implant dentistry, actually 3 now. There's 048, 050, and your star style driver. We happen to use the 048 hex driver, which is compatible with 3i, Branamark, Ankylos, and others as well. Now, one of the things you really need to do when you take this impression is you need to align the impression coping with the implant itself. And if you simply push down and twist, your lobes will mate after the lobes align together, and then you put in your screw, your guide pin screw, to hold everything down into place. If you utilize that technique, you shouldn't have any problem with the impression coping seating down into your implant. Again, there's only one analog for this. Now, if you want to practice the impression technique outside of the mouth, you can go ahead and get your analog and get your impression coping and do the same thing that you would do in the mouth, but do it outside of the mouth, because the implant analog mimics the implant that's in the mouth. So you see the two impression coping and the analog lined up. Go ahead and put those together after you've taken the impression as well. Then you can reinsert that into, as you can see there, insert that back into your impression. Don't leave that up to the lab. You do that, so that way you have complete control of the case. Okay? Now, one of the things to look at also when you're taking these impressioning techniques and models themselves, as far as your working models, is your soft tissue model. Now, the thing to note about your soft tissue model is that mimics the soft tissue that's around your implant in the patient. So your laboratory will pour up your working model as well as pour up your soft tissue model, and you can clearly see that, again, implant analog, or excuse me, impression coping analog pushed back into the impression itself. Notice a deep well around the soft tissue around that molar rescue implant. That is what you'll get with a bone level type implant. It's a deep welling effect, which you have very, very healthy soft tissue around that implant because of the conical seal, which is 5 degree or your 11 degree Morse taper, as well as your tri-lobe connection. Now this is a custom castable abutment here that you can see that's made out of, again, the UCLA. Now the reason that is why? Because notice how the different flare, they're trying to match the different size molar flare, the natural emergence of a molar, and they used a UCLA in order to do that. So these implants really mimic ideally what nature has given us, which is a natural emergence profile or large emergence profile for your rescue type implants. Okay? Now this is something that's really key regarding the laboratory. Look at the type of abutment that you're looking at here. It's only a 4 millimeter flare, but look at the width of the crown. It's 10 millimeters. So your laboratory framework is going to be too thick. All right? Now what would happen if we place a wider flare or a wider profile type abutment in that same type of impression? Look what happens if we place a 6 millimeter flare. Our metal thickness of the framework is thinned out quite a bit. Okay? So therefore you have less porcelain on your lateral aspects that will not chip off. So the key is to really get your framework properly thickened in your different areas regarding your framework and to not have it too thin or too thick in certain areas. You can clearly see the natural emergence of a molar, again, talking about the rescue implant. That's really the huge benefit of the rescue molar implant, is because you have your natural emergent profile crowns type with these natural molar restorations. Look at your different type torque wrenches here in this. This is really key and very important. You have your Astra, Lifecore, Zimmer, 3i, Noble Biocare, and Straumann type torque wrenches. Now each one of them has a different type engaging mechanism. The ones on your left have a square insert drive. The ones on your right have like a latch type insert drive. And we're going to go over that in a minute in more detail. Look at your Megagen torque wrench set. There's only one driver for this whole system, for all of our systems, and it's an 048 driver. Okay, so, or what they also call a 1.2 millimeter driver. So what you're going to do is go ahead and grab your torque wrench out of your set, and you can start playing with your torque wrench and look at how the different insert drivers engage the torque adapter. And we're going to go into that in just a second. But also, again, like I noted earlier, there's 050, 048, and your star type drivers. There's only 3 type of drivers in all of implant dentistry. Once again, 048, 050, and the star driver. Now, what did I mean by square drive? You see how the picture on the left shows that insert being square, the insert driver being square, the little silver thing on the right hand side. Okay. Now your torque adapter is on the left. Now what happens when you put them together? The square insert driver fits into the torque adapter, which then fits into your torque wrench. Okay. Now one of the things about our torque wrench that's very, very user friendly is that it has different levels of torque setting: 15, 25, 35, and 45. Now you can see there the arrow shows the indicator, or the screw body that screws into the torque wrench itself. You want to make sure that that is fully engaged into your torque wrench before you use it, because if it's not fully engaged, your little torque tip or your torque adapter will fall out. So you want to make sure that that is screwed all the way up to the body of the torque wrench itself. There's your torque adapter on the left, your insert driver on the right, and again, those two things, when put together, fit into your torque wrench head. And again, you can clearly see the insert driver and the torque adapter put together and ready to be inserted inside your torque wrench head. Okay, you can see the 048 driver, or the 048 tip in there, and that's how it's fully assembled on the upper right hand side. That's ready to use as it is right there. Note the little spring is always facing you, so it should always face you or towards your body. And there you can see the torque indicators: 15, 25, 35, and 45. So this torque wrench is very user friendly for all implant systems on the market, not just Megagens. You can use this system for our torque wrench rather, for other implants as well. Again, 15, 25, 35, and 45, because most companies are either 25, 35, or 45. All right. Now, one of the things that you want to look at also, excuse me, is the long axis pressure with your finger. Right where the arrow is, you want to make sure and put your finger, your index finger, down the long axis pressure with your forefinger, to make sure you always have plenty of force down inserted inside the screw itself, so that little hex won't tip out of the screw as you're torquing it into place. All right. Now again, when you're going to be utilizing this torque wrench, you want to make sure that it's assembled properly and nicely oiled and ready to use. One of the questions I always get is, do Straumann inserts fit into the Megagen torque wrench? And yes, they do. Your Straumann insert will fit inside the Megagen torque wrench as well. Okay. Now again, you can see on the lower right hand side the spring, as it's pulled back, that is your torque wrench indicator on how much torque you have being put on the screw assembly itself, with the abutment and screw put together. Okay. Now there's another type of torque wrench on the market where the head literally breaks over. Now you see an abutment clamp or a hemostat being utilized for counter torque stability, but as you draw your torque wrench head to the clockwise position, Once it reaches that torque mechanism or torque aspect, the head will break over. Do not continue to torque with this type of torque wrench when you're utilizing that type of torque wrench mechanism. But that torque wrench only goes typically to 30 or 35 Newton centimeters. If you have any questions whatsoever, you can please call me at 480-440-3927, or you can email me at joelg@megagenus.com. Thank you. Have a great day.